There may be a genetic basis to many mental disorders, especially schizophrenia, depression, anxiety, and Alzheimer's. Also, addictive tendencies can run in families. Alcoholism, gambling, there appears to be a genetic component. Genetic screening can be helpful to diagnose, to treat, in some cases, possibly to prevent certain illnesses, depending on how you feel about these kinds of tests. We have diagnostic tests that can be used to identify or rule out specific genetic or chromosomal abnormalities based on physical signs and symptoms. They may be performed before birth or after birth. An example of a diagnostic test is Huntington's disease. There are also predictive or pre-symptomatic tests that can be done. These identify genetic changes that increase the likelihood of developing diseases later in life. It may be done if a family member has a specific disorder. For example, if you find in your family tree certain types of cancer, for example, breast cancer that may occur before menopause, that might be a reason to test for the mutation of the BRCA gene. And different tests can be used for the same disease. We have carrier tests, meaning even if you don't have the disease and you won't get it, do you have the gene for it that you can pass on to your children? Sickle cell anemia, cystic fibrosis. Prenatal testing can help identify fetuses that may have certain diseases. They can detect changes in genes or chromosomes before birth. And newborn screenings include testing for PKU or phenylketonuria. This is a genetic disorder in which the baby cannot metabolize the amino acid phenylalanine. Folks who have this disorder can't ever use aspartame. Ask me about it. Gene therapy is when a gene is spliced into a virus that then gets inserted into the human DNA. That gene then produces a therapeutic protein. Let's watch.
Genes make us who we are. Are we tall or short? Do we have blue eyes or brown? Our genes hold the answer. What if part of the gene is defective or missing? Or if a gene changes or mutates? It can cause a disease like cancer. Enter gene therapy. Among other things, scientists can replace a bad gene with one that is healthy, add a new gene to perform the function of a defective or missing gene, or they can turn off a problem gene. How do they do it? Say scientists want to add back a healthy copy of a gene to cells. They need an efficient way to do it. So scientists use vectors or vehicles to deliver a gene. The healthy gene hitches a ride in the vector. Viruses are one kind of vector. Scientists modify a virus to remove its ability to cause a disease. The modified virus can then be used to carry the healthy gene into a cell. Gene therapy can happen on cells inside the body, or can happen on cells outside, and then transplanted back in again. Genes make us who we are, and gene therapy holds great promise for a healthy future.
We're not going to watch that next video. Sickle cell anemia is an example of a condition in which gene therapy has been shown to work. On the left, on the top, we're looking at a normal red blood cell. Red blood cells contain the protein hemoglobin, which is coded for in the DNA of the nucleus of the cell. There is a condition called sickle cell anemia in which the number 6 cocktail chatter amino acid is substituted. A valine takes the place of something called glutamic acid. What this does is change the structure of the red blood cell, and I like to say with protein, structure dictates function. You change the structure of the red blood cell, you change its function. The iron in hemoglobin transports oxygen from the lungs throughout the body. When the red blood cell is sickle-shaped due to this change in just one amino acid, it inhibits the transport of oxygen and many, many other symptoms. Here is a slide of numerous sickle cell-shaped red blood cells. Let's listen to a short clip of one young man's story who had a transfusion of plasma containing cells that had been treated with gene therapy. Doctors don't like to say the word cure, but this is coming awfully close.
An incredible breakthrough for a young man treated for sickle cell disease at the Dana-Farber Boston Children's Cancer and Blood Disorder Center.
If you look at his blood smear today, you could not tell that he has sickle cell disease.
Working out, haven't had a transfusion in almost 6 months, just about, and feel great, trying to look great, trying to be great.
21-year-old Manny Johnson is the first success story from a new gene therapy strategy for sickle cell disease.
I started to see improvement in my skin, my body, the blood levels, and I was able to be less restricted.
Scientists have known that sickle cell patients with a high ratio of what's called fetal hemoglobin do better. Those are red blood cells typically found in babies. Sickle cell disease only affects adult hemoglobin. For this trial, Manny's stem cells were collected for a new type of genetic manipulation. Researchers introduced new genetic material into his blood, hoping to get the body to produce the fetal hemoglobin and silence the sickle-producing adult hemoglobin.
The day that Manny received his cells back was a pretty emotional day, I think, for the whole team.
The team is encouraged by what they're seeing in Manny. Up until now, the only known cure for sickle cell disease has been a bone marrow transplant. As for Manny, getting his health back is one thing, but he says an even bigger motivation for going through this trial is his 7-year-old brother, who also has sickle cell disease.
Just telling him this is all for you and everybody else just like us, so that way he wouldn't have to endure what I endured for him. Make his life a little easier as he grows up.
This is an example of a family health pedigree. It's a tree diagram illustrating patterns of illness and health within a family. What can you learn from your genetic pedigree? An early onset of a disease is more likely to have a genetic component. For example, a heart attack or a breast cancer before the age of 50. Multiple instances of a disease in individuals on the same side of a family is more likely to have a genetic component. What else can you learn? A family with multiple cancers represents a greater likelihood of a genetic association, and the presence of a disease in family members who have good health habits is more suggestive of a genetic link than those members who have a disease due to poor health habits. So, what did you learn doing your family tree? Let's talk about it. And after we talk about that, we'll try some Gene Jeopardy. Okay, see you in class.